Morning. The Prime Minister, Boris Johnson, is promising that more than 23 million people will be able to book a booster jab by the end of January. It's a massive expansion of the vaccine programme, and the government is appealing for thousands of volunteers to help the NHS. Temporary vaccine sites will be set up around the country, and around 400 military personnel will assist the rollout. But if Mr Johnson had another message, it was that Christmas is safe and there is still time to party. The Health Secretary Sajid Javid is with us. Lots to get through. Let's talk. Good morning to you.
Good morning.
Let's start, first of all, with our viewers' sense of exhaustion this morning that we have to deal with another twist and turn in this COVID challenge. How are you coping with it all?
Well, there's a lot of work to be done, and I'd just actually start by thanking all the people in the NHS, especially in social care, for, think of the 2 years that they've had, the most challenging time, I think, fair to say, in living memory for anyone working in care and health. And now, this variant comes along, and it's we have to still ask more of them. I know they're up to it, but it's a big ask, and I just want to start by thanking them. And I mean, with this variant, we're trying to learn and assess more about it. And in that meantime, in the next few weeks, we want to build our defences. And our best form of defence still remains our vaccines. It's possible, of course, it's possible that it might be less effective. We just don't know for sure yet. But it's also very likely that they'll remain effective against serious disease. And that's why we made the announcement around the booster programme yesterday. I asked the JCVI, that's our group of independent advisors on vaccines, whether it would now make sense in light of this variant to really expand the programme. It's already really successful, but to really properly expand it. And they came back and said we should do just that by dosing, halving the dosing interval, and also by expanding it to all adults. And it's a real national mission, I would say, for all of us. We've all got a role to play on this. And if any of your viewers, if they get the call from the NHS, then please do, I would just say to them, please do, step up, roll up your sleeves and protect yourselves.
23 million booster vaccines to be slated by the end of January, though. That's a tough ask, isn't it? That's, what, 500,000 a day?
It's a huge ask, and it's something I do believe that all the people working in the NHS, all the volunteers, they are up to it. But it of course is a huge ask, and that's why I call it a national mission. This has become, from a health point of view, the most important thing that we can do to protect ourselves, to protect the progress that we've made. But I know that the NHS are up to it. In the last week, before sort of Omicron was a thing, I think delivered about 2.4 million vaccinations across the UK, and that's obviously that's huge. We need to now increase that by around a million a week, but I think it can be done to give everyone an offer by January. But it's really important that people take up that offer, because that's what's going to protect us.
Let's canter through. Lots to talk about. The PM says the new rules will be assessed after 3 weeks. What criteria will you use?
The key thing will be the assessment of our scientists of the variant. Now, what we need to determine, is it any more dangerous than the Delta variant? And as I say, we don't know the answers to that. We've seen in the last few days a number of scientists, whether from here, from South Africa. I spoke to my counterpart in South Africa yesterday, and let me also just say, I think the way South Africa has behaved is exemplary in being open and transparent about what it discovered. But in talking to other scientists, we don't know enough about it yet, but that will be the key thing, is to determine if it is any more dangerous than the current dominant variant, the Delta variant.
3 weeks is an arbitrary figure, isn't it, really? Because it could take longer than that for us to know whether people have got it and then find themselves in hospital. We won't know within 3 weeks just the challenge that we're facing with this.
Well, I wouldn't call it an arbitrary figure. I think where you might be a bit right is that
only a bit, right?
Only a bit. Is that it might take a bit longer than 3 weeks. It might be a bit sooner than 3 weeks.
The thing is 21st of December as opposed to 25th. You can see where I'm going with that.
Yeah, no, of course, and that's why we're confident that actually maybe within 2 weeks that we can know a lot more about this. We might not even need to wait 3 weeks, but the 3 weeks was, I think, a sort of a sensible date to set for a review, because now that we have live samples of the virus, they've gone to our labs in Porton-Down. Our scientists, some of the best scientists in the world, are working through it. We're working with our G7 colleagues. I held a meeting with G7 health ministers on Monday as well to discuss this. And so we're working internationally. We're working at pace at home. And I think in a couple of weeks, we will know a lot more about this variant.
Between now and then, the Prime Minister said we should be attending Christmas parties. The chief advisor saying we shouldn't. Where are you?
Well, I think people should continue to behave in the way that they were planning to behave over Christmas. I don't think there's any need to change those plans. The only changes that have been made in the last few days are the ones that everyone now, I think, knows about it might affect your international travel plans. So if someone had plans to travel over Christmas, then there could be an impact there, of course. There's the need to self-isolate if you come into contact with someone with Omicron.
Yeah, are you worried about a pandemic?
No, I'm not. The case numbers are well, at this point in time, the case numbers are very low. I think throughout the UK, we've got 22 confirmed cases at the moment. Now, that will go up. It will certainly go up. But the numbers are low. I hope it sort of stays that way. So I'm not worried about the sort of pandemic type situation. But we've always also said that even before we knew about the variant, in our sort of plan A, we've always been clear that as you get into deeper winter, the colder, darker days, the virus likes that. Not just this virus, the flu virus, they like that. And so, as we do that, then people should just be careful to try and think, can they ventilate a room and just follow the current guidance.
Let's crack on. Should people take a test, a COVID test, before they go to a Christmas party?
I would. It's not a formal recommendation, the guidance, but if I was going to a party with lots of people and things, I would. But I would have done that, by the way, even before we knew about this variant. Again, the reason I would have done that is because it's getting colder, it's getting darker, we're spending more time indoors, probably more people indoors than before, just because of the colder, darker days. So sensible precautions that everyone can take.
You're talking about overseas travel. Labour is saying that there should be pre-departure tests from the country that you are in before you come into the UK. Why don't we do that? We used to do it.
We did used to do it, and we got rid of it because we didn't think we needed it anymore. When the variant came along, and with what little we do know about it, we had to, it was right to take some measures around travel. And the most important one we actually took is the red listing. So the moment I learned about this virus and the potential threat of it, within hours, we red listed 6 countries in Southern Africa. We've added 4 more. We were the first in the world to do that. And then also we've put in this measure around if you come in from anywhere in the world that you will have to take a PCR test by day 2 and only leave isolation if you get a negative test.
Is it under review, the pre-departure testing?
Well, we keep all these rules under review. I don't anticipate any change from what we've announced just in the last few days, but of course we always keep it under review. Should the situation change, then we would have to look at that again, but I don't really anticipate any change for now.
The World Health Organization yesterday said over 60s shouldn't travel overseas. What do you think?
Look, the World Health Organization is taking this very seriously, which is really important, and we are working with them. It's understandable they're concerned about them. No, I would just say, again, we just stick to what we already know, right? Even there's a lot we don't know about the variant. What we know is that the older you are, the more vulnerable you are to this virus, and there are ways to sensibly protect yourself. So if you ask, if it was my mother, I would say to her, she's got her booster shot, so that's great. If she really wanted to travel, wear a mask on the plane and things like that. But I don't think she should be worried about travelling. So that would be my advice.
You talked about South African scientists and how much praise they needed. Again, talking about the World Health Organization yesterday, they said that because of what we did and the fact that we put them and the other countries on the red list, that disincentivises countries to report and share epidemiological and sequencing data. Do you agree?
Well, I think there's a point about making sure that those countries that come forward and share the information, like South Africa did, like the UK did, when we had the Alpha variant. You'll remember that. And we were very open with the rest of the world, just in the same way South Africa is. And that's the right thing to do.
South Africa's a much poorer country than us, and they rely much more on tourism, and they're being penalised.
I wouldn't say they're being penalised. I agree with everything else you've just said about South Africa, but it is really important that the rich countries, that they recognise that South Africa has come forward, done the right thing, and offers it whatever support it needs. So on the call that I organised with G7 health ministers on Monday, we talked about this. It was in our final statement about praising South Africa and offering even more support than otherwise. And yesterday, it's one of the reasons I had a call with the South African health minister to offer our support.
So you don't agree with the World Health Organization that it disincentivises countries? You put them on the red list?
No, I think it's important that countries come forward, but there are other ways to support them.
OK. Can we talk about NHS waiting times, please, if we may? National Audit Office report estimating that if 50% of those that have missed their referrals during the pandemic come forward, then the waiting list would reach 12 million by March 2025?
In fact, I think I've previously been on your programme and said it could reach 13 million for precisely the same reason. And by the way, I do want people.
This factors in the money that you hope to raise as well, though, doesn't it, from the national insurance contributions, the rise in next year?
I don't know if it does.
Apparently,
but yeah, I don't know. And even if it did, I don't think they would at this point know about all the plans that we've got to get through the waiting list much faster than otherwise because of all the new funding that's coming. But that said, the waiting list will rise before it falls, and it will rise for two reasons. First is that a lot of people that didn't come forward are coming forward. And again, I want them to come forward. I hope it's more than 50%. Even that's more work for the NHS. I don't want anyone to think that they have to stay away from the NHS. And secondly, we've got a lot of demand in any case, even before the delayed demand, there's all the sort of usual demand that would be there. Now, that said, the work that we're doing on, especially on elective procedures and diagnostics with the new community diagnostic centres, with the surgical hubs, this is all going to make a big difference. It's already helping.
Will things be better by this time next year?
I think we'll be getting through a lot more procedures on a daily basis than this time last year, and that's going to be helping a lot of people.
Will it be better by this time next year?
It'll be better because we'll be getting it through a lot more procedures.
OK. Let's talk about the social care plan, because we're almost out of time. We're going to get the white paper. I always think so. The white paper later on today. Will it be clearer by then how many people will have to sell their homes?
The white paper that's coming out today is less about the new means testing system, which is really generous.
We told it would be where the detail was, didn't we?
Well, no, this white paper, I don't want to. There's a couple of white papers that are planned for adult social care, and what the white paper today is about is in the spending review there was over £5 billion allocated to adult social care. Of that, just under £2 billion, and £1.7 billion is for what's called it's funding for the adult social care system, improvements to the whole system. So this is about spending on the workforce, on training, on occupational therapy and support.
How many people have to sell their homes?
Well, you will know today is about how we're going to support adult social care much more. When it comes to the question you just asked me about selling homes and not, what we already know, you don't have to wait for that, is that we've already set out plans that means that billions more a year will be going in to support people with their adult social care costs, with the most generous means testing system this country has ever seen for adult social care, and with everyone's cost of care being capped at £86,000.
OK, we need another 15 minutes on that, don't we? So I'm sure you'll come back and talk to us about it in more
to.
detail. In the meantime, what are you doing for Christmas?
I'm spending it with my family in Bromsgrove.
OK. Just a small group or a big party?
Just my family.
There we go. It's good to talk to you. Thank you very much indeed for joining us. It's always a pleasure. Thank you.